Welcome back to our channel. This is Sara Makin. I'm the founder and CEO of Makin Wellness, and today I'm going to be talking to you about seasonal depression. So I will talk about everything from diagnosis to treatment to prevention. If you find this video to be helpful at all, please give it a thumbs up and be sure to share this with someone that could benefit from it. So let's go ahead and get started. So there's a lot of research that has been done, but the cause of seasonal depression is not entirely known. There are two predominant theories out there right now. The one being that the lack of sunlight is what triggers seasonal depression, or the lack of availability to sunlight. And so exposure to light may help to reset the biological clock. And so if you're not having that biological clock reset with light, it can cause seasonal depression. The other biggest theory out there that explains what causes seasonal depression is that melatonin, which is the chemical that is known to affect sleep patterns, could play a major role in seasonal depression. Melatonin is released in your body when it's dark out. And so if you live in a climate where you don't have too much sunlight, you could have an excess of melatonin that could make you feel very sleepy and very sluggish. So those are the two biggest known theories. The more important thing to consider are the symptoms, and what essentially are the symptoms of someone who experiences seasonal affective disorder. And so the biggest thing, again, to consider, and you'll hear us talking about this in all of our videos, is that no one experiences mental health challenges in the same way. There's always going to be various symptoms. You might experience the majority of them, or you might only experience a few. So the biggest and most common symptoms are sadness, anxiety, irritability, loss of interest in stuff you normally like to do, having a challenging time with concentration, feeling like you need to sleep a lot, craving a lot of carbs or sugars. And so those are the biggest signs, as well as having a lot of fatigue and just being exhausted a lot. So those are the biggest symptoms. In regards to diagnosis, and if you're wondering, well, I have some of these symptoms, do I have seasonal depression? And my biggest tip for you is to call up our team, have an evaluation done. One of our highly rated providers will be able to diagnose you virtually, and then you can find out for sure that way. You don't ever want to use any YouTube video or any tool online to diagnose yourself. It's important to have a full assessment done, so consider that. In regards to treatment, research shows that phototherapy, also known as bright light therapy, is an effective method of treatment for seasonal affective disorder. When I first started studying treatment options for seasonal depression, I honestly thought this was a little bit hokey, but once I started to look into the research and see the benefits for it within our company and also within some people that I know personally, this is actually a very effective treatment option. Many times after people use a bright light therapy, they feel like they have more energy, and sometimes people don't feel that big of a difference in their emotions after they use it, but they notice it during the rest of the day. I have one right here. This one is called, I believe it's like the Verilux lamp. I can link it below. You can get a seasonal depression light for about 30 or 40 bucks online. It's not very expensive, and it can work wonders. So using that in conjunction with virtual cognitive behavioral therapy is shown to provide great results. So CBT has research showing that it can produce long-lasting outcomes for people with seasonal depression. And essentially what you would be doing is meeting with your virtual counselor, and they are trained in helping you to reshape and really challenge negative thoughts and focus on thinking more positively. It's extremely effective, and our team is all trained on how to do this. And now, if you are considering, well, what about this light therapy? Is this safe? Should I use this? Should I not use this? And for the most part, it is safe. There are some cases where it is not recommended. So if you have a weak retina, this could potentially be harmful. The other thing to consider is if you have been diagnosed with bipolar disorder, you would need to have medical supervision in order to use a light lamp. So be sure to talk to your PCP. You can give their office a call and ensure that it is something that your doctor does recommend. There are, just like with really anything, there are side effects to using a light lamp, such as eye strain. Sometimes people get headaches. Sometimes people feel irritable when they use it. And other times people feel fatigue. And this is actually really best to use your light lamp first thing when you wake up. You want to kind of consider using this light lamp as a substitute to having the sun early in the morning. And so that would be the best time to use it. If you do use it throughout the day, it could mess up your sleep cycles. And many professionals would recommend that you get a light with 10,000 lux and to use it for about 15 to 30 minutes in the morning. And people typically start to notice improvements within 2 to 4 days. The other thing to consider is that if you stop using the light therapy, typically people will then start to notice the symptoms of seasonal depression come back very quickly. So this is important that you stay consistent with using it. What we typically recommend is that you use this and you incorporate it into your morning routine. So then that way it becomes an automatic thing. And then whenever the sun starts to come out, like more in the summertime or during the spring, then you can stop using it. The last thing I wanted to talk about is prevention. And so the question is, well, I'm prone to getting seasonal depression. Is there anything that I can do to prevent it? And the good news is yes. And so using the light box or the light therapy in the fall, before you start to feel that those sluggish or those depressed feelings, can be really helpful. Spending some time outside every single day, and I know with COVID, this is kind of a weird, if you're watching this and you live in an area where the COVID rates are really high, it can be a little bit challenging, but that is ideal if you're able to do that. Eating a well-balanced diet, your mental health benefits substantially when your body is getting the right nutrients, and making sure that you're having good quality nutrition is very important. Exercising, if it's possible to exercise at least 3 days a week, that can really prevent seasonal depression from occurring. Staying involved with your friends and family, being connected with people that you love, and staying consistent with your online counseling can be extremely effective. All of those things can be done to prevent seasonal depression from occurring. So I hope you found this video to be helpful. If you have, please be sure to give it a thumbs up. Subscribe to our YouTube channel so you can get notified every single time we share some mental health, addiction, or relationship-related content. And leave us a comment below of what video you would like for us to create for you next time. Thank you so much, and I look forward to connecting with you in the next video. See ya.